Speaker, at the Cape Breton Regional Hospital, people are waiting more than double the time the average Nova Scotian waits just to see a doctor. We're talking about hours in pain with no clear timeline for care. We heard from an 11-year-old who sat in the ER with his mum for almost 10 hours. He was surrounded by sick kids, crying babies, and people vomiting. He said he felt like no one cared. Why is this government okay with kids in Cape Breton waiting hours in pain?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So certainly we continue to work very hard to make sure that we have the folks that we require in our emergency rooms across this province. We've invested in waiting room care providers. We've invested in waiting room care attendants who can help support people in terms of being more comfortable while they wait. We do work on a triage system, the Canadian Triage Acuity Scale. It's an essential tool for people working in the emergency department to prioritize care as required. There are a number of different ways in which people can access care: virtual urgent care, virtual emergency care, pharmacy clinics, all of those things. So we're working very hard with our partners at Nova Scotia Health and IWK to make sure that children get the care they require in the province. Thank you.
I recognize the Honourable Member for Cape Breton Centre, Whitney Pier.
Unfortunately, Madam, children always present differently than what is occurring behind the scenes. Speaker, Cape Bretoners like the 11-year-old aren't just waiting longer. They're driving further and getting less. They can't depend on their emergency departments being open when they need them to be. People are waiting over 6 hours just to see a doctor, more than double the provincial average. This isn't just an inconvenience. It's putting people's health and lives at risk. When will this government make sure families in Cape Breton can get timely, safe emergency care when their children are hurt?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker, and I certainly want to give a shout out to the emergency room staff, not only in Cape Breton but across this province. They are very skilled, competent, capable individuals. We have specialty care at our regional hospitals, and I don't want anyone to think that they don't give safe care in those spaces at any point. When people need emergency care, they should present to the emergency room. In fact, through an integrated healthcare system, care begins when you speak to dispatch. For individuals with lower triage, there are a number of different options where they can access care: urgent treatment centres, virtual care options, pharmacy care clinics. It's really important. We're working very hard to help people navigate to the appropriate service, and we'll continue to work on those protocols.